In this lesson, we'll finish up the systemic circulatory routes by taking a look at the blood vessels of the lower extremity. So let's start with the arteries. So we had said in a previous lesson the aorta ends at the level of L4, L5, and it divides into the two common iliac arteries. Well, we're going to see that common iliac arteries is a major feed of blood into the lower limbs. Plus, it's going to supply the organs of the pelvis. So let's take a look at the common iliac arteries. First of all, common means it's going to split. And again, common usually means it's splitting into something external and something internal. And that's exactly what it does. The internal iliac artery actually stays inside the pelvis and it supplies the important pelvic organs, the bladder, the pelvic walls, the external genitalia, the inside of the thigh, uterus, and the vaginal canal in the female. The external iliac artery, right, the other branch, is actually going to enter the thigh, becoming the femoral artery, right? So inside the thigh, it becomes the femoral artery. So we can see here, just so you have an idea, right here is the common iliac artery. We like way up over here. This branch here, we didn't label it, but this would be the internal iliac artery going into the pelvis, and then this is now going to be the external iliac artery. Once it crosses the inguinal ligament, it now becomes the femoral artery right there. All right, just to blow up. Common iliac artery. Again, internal iliac artery. This is the one that's going to stay inside the pelvis. Here's your external iliac artery. So on a model, you have to look for this split. Above it is common, internal, external. And again, once we cross this inguinal ligament, the external iliac artery we just changed its name, becomes the femoral artery. So the femoral artery is a pretty big artery that goes down the thigh and eventually crosses through the adductor magnus, and it goes to the back of the knee. There are some branches. You're not going to find these on our models, but there is a deep femoral artery that goes to the anterior lateral aspect of the thigh. It does our hip joint, the ball and socket joint, the femoral head, and even some of the deeper muscles of the thigh. And then that deep femoral artery will give branches known as the medial circumflex and the lateral circumflex. They're going to supply the muscles of the thigh. Again, these deep femoral, the circumflex arteries, you're not going to see on our models. So this femoral artery eventually goes through the adductor magnus and it comes out the back of the thigh behind the knee. And what we do then is we change it, the name, into the popliteal artery. So let's see. Right about here, guys, you can see here's the femoral artery coming down. Right, and right about here this is where the adductor magnus muscle will be. There's actually a hole in the adductor magnus called the adductor hiatus, and the blood vessel goes right through there, and then it comes out the back of the knee, and then back here, this is going to be the popliteal artery on the other side. And same thing, here's the popliteal artery on the other side. Now, the popliteal artery, once it emerges behind the knee, it's going to split into two main arteries. One artery is the anterior tibial artery. That's actually going to go right between the tibia and the fibula and then go to the front of the leg where it supplies muscles like the tibialis anterior, extensor digitorum longus, extensor hallucis longus, all those muscles on the front of the leg. And then eventually this anterior tibial artery is going to go right down to like by the big toe, and it terminates as the dorsalis pedis artery. So I'll show you real quick right here. Here's the popliteal artery right behind the knee. And then the popliteal artery is going to be two branches. One is the anterior tibial. The other branch we're going to do is the posterior tibial. This anterior tibial goes between the tib and the fib, and it goes to the anterior compartment. Okay? That's what we were saying here, right? So the anterior tibial artery enters the anterior compartment, and then it goes down the front of the leg where it terminates as the dorsalis pedis artery. The second branch of the popliteal artery is the posterior tibial. All right, so let me just show you that. All right, here's your popliteal. Here's the anterior tibial going to the front of the leg, even though we're seeing it from the back right now. And then here's your posterior tibial. Long artery goes all the way down like that. Now that posterior tibial goes into the posterior compartment. It supplies muscles like the gastroc, the soleus, the plantaris, popliteus, all those muscles back over in here. But there is a branch off the posterior tibial that goes into the lateral compartment out over here. If you remember, this is where fibularis longus and fibularis brevis muscles were. Well, this blood vessel goes over and supplies them. So guess what we call it, since it's going by the fibula? This is the fibular artery. Okay, so the posterior tibial artery descends the posterior compartment, and it will give rise to the fibular artery, which goes into the lateral leg. And again, that's going to do the fibularis longus and the fibularis brevis, that type of thing. At the ankle, the posterior tibial artery is actually going to go to the bottom of the foot and go, into the sole of the foot, and we call them the plantar arteries. There's actually a medial and a lateral plantar. Okay, so one more time over here, popliteal. It's now going to divide into two arteries. One, two. Number one is the anterior tibial artery, which goes into the anterior compartment. Number two is the posterior tibial artery, which goes into the posterior compartment. And then along the way, the posterior tibial will give rise to the fibular artery, which goes into the lateral compartment. Right here we can see a front view. Here's the anterior tibial artery coming down the front of the leg, and then if you follow it down here, this is where this dorsalis pedis muscle is. Artery goes over the dorsum of the foot and kind of over towards the big toe here. That's one of the pulses you can take on somebody if you just kind of touch the top of their foot. Right, you can feel the dorsalis pedis pulse. Okay, so that's the arteries. Now, same as the upper extremity, if you know the arteries going down to the foot, the veins are the exact same thing going backwards. These are what we call the deep veins, right? So they just run in reverse, right? So if you know the arteries, you automatically know the veins. But just like the upper extremity, we did have some superficial veins. Remember the cephalic vein, the basilic vein, and the median antecubital vein. Those veins were all superficial. They were kind of closer to the skin. Well, we have the same thing in the lower extremity. However, there's two of them that I'd like you to know. The longest vein in the body is called the great saphenous vein. This is an important vein clinically because they try to preserve this vein. If somebody needs a bypass, say a triple bypass or a quadruple bypass, this is the vein they take out, this great saphenous vein, and then they cut it into pieces so they can use it for a coronary bypass. So watch this, longest vein in the body. It starts way down here by the ankle, and see this light blue vein? Look at this, right up all the way up here, and then it's going to dump into the femoral vein way up here. So look at the size of this thing. Long vein, right? So this is one vein they always try to preserve so they can use it for cardiac surgery. The second vein is called the lesser or the small saphenous vein. This starts on the lateral malleolus out here. That's this one. And then it's going to dump into the popliteal vein. You can see it behind the knee there. It's kind of watermarked behind the knee. That's going to be the lesser saphenous vein. So great saphenous vein, lesser saphenous vein. Right, here's a posterior view. So great saphenous vein going all the way up to the femoral artery. Femoral vein. And then here's the lesser saphenous vein right here. Okay, so that's our blood vessels of the lower limb.